Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're doing another Kahoot, and we're going to be going over drugs, medications. Now, guys, every single drug I have on this Kahoot, you need to know it. So not only, whatever that drug is, not only that drug that's the answer, but all of the other options that I provide as options, you need to know those drugs. You need to know the indications for those drugs. You need to know the nursing intervention for those drugs. You need to know any relevant lab values for those drugs. Every single drug mentioned in this Kahoot has been seen on NCLEX numerous times. Make sure you know them. Don't say I didn't warn you. Now, before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. You're going to love it. Go ahead and give it a thumbs up now so you don't forget. Subscribe to my channel if you haven't done so already. And be sure to check out my website. I have so many resources available. You can sign up for Next Generation NCLEX Review Part 1 and Part 2. Part 1, I teach you how to think like the test writer. I teach you how to think critically. I teach you about prioritization. I teach you about delegation. I teach you about certain scenarios that NCLEX will place before you and where your mind is supposed to go, what type of answer you're supposed to be looking for. In part 2, we actually go over NCLEX type questions, rationales, and how to apply them to your type of questions that you get. You can sign up for a private tutoring session with me. Maybe you want to pick my brain or ask for advice about something that has to do with the arena of nursing. You can sign up for a consultation session. Maybe you're in the program, you haven't graduated yet, you're just trying to survive the program. You have to do really well on your next exam. Check out the audio lessons I have available. See if I have one that matches the content of your upcoming exam. Very soon coming down the pipeline is going to be my Nexus Nursing Test Bank. These are questions for you to practice. The concepts have been seen on NCLEX over and over and over and over again. This is for LPN, RN, and nurse practitioner students. That's coming very soon. So be sure to check out my website, nexusnursinginstitute.com. Almost daily, you can find me covering a variety of nursing topics across my social media platforms. TikTok, I don't know how long we're going to have TikTok, but TikTok, Instagram, Facebook, YouTube, my handle's the same everywhere. Nexus Nursing. So guys, without any further ado, let's get started. Pharmacology. First question. Enoxaparin is contraindicated if the patient has what type of allergy? Penicillin, pork, peanut, or egg? Enoxaparin would be contraindicated in a patient if they have an allergy to what? Penicillin, pork, peanut, or egg? Wow. Only 18 people chose pork. You guys better know this medication, guys. You better know it. It's an anticoagulant. It prevents thrombus formation. And if you're ordered to give this medication, you look in that patient's chart and you see that patient has a pork allergy, you're not going to just blindly give that medication. If they have a hypersensitivity, what are you going to do? You're going to place a phone call to the healthcare provider and say, hey, did you know this patient has hypersensitivity pork? Some other things that NCLEX expects you to know regarding this medication. You have to know the drug class, which I said is an anticoagulant. You have to know the action. It prevents thrombus formation. Obviously, you have to know contraindications such as pork hypersensitivity. You also have to know a couple other things. You got to know what else do you have to know about this drug? Oh, after administration, no massaging or aspirating the site, and no injection of air before administration. And I'm missing one. There's one more important thing you got to know for NCLEX, bleeding. You're going to be assessing your patient for bleeding. You're going to be, checking the urine, check the vomitus, check the stool, check the saliva, any signs and symptoms of bleeding. Make sure you guys know this medication. Yep, soft bristle toothbrush, right? We don't want them to bleed out. Very good. Okay, what is the action of cefdinir? Is it bactericidal, causing cell wall death? Does it improve attention span? Does it suppress inflammation, or does it prevent nausea? What's the action of cefdinir? Very good. It's an antibiotic. It's a bactericidal. When you see that word cidal, that means what? Death. Death of bacteria. Bactericidal causes cell wall death. You absolutely need to know that. Improving attention span. What class of drug would we give to improve attention span? It would be something like a CNS stimulator. Professor D, do I have to know those CNS stimulators? Yep. Suppresses inflammation. That would be a steroid. Professor D, do I have to know them? Absolutely. And of course, prevent nausea, antiemetic agents. Okay. How are you guys doing on the live? Okay, let's keep going. They're from the same family of drugs. All right, adverse effects of this drug includes ototoxicity, nausea and vomiting, nephrotoxicity, red man syndrome. And guys, this is just to name a few. I just gave you the worst of the adverse reactions. What drug are we talking about? Metformin, vasopressin, Venco, or meperidine? I spelled that wrong. Sorry. What drug am I talking about? Ototoxicity, nephrotoxicity, nausea, vomiting, red man syndrome. Very good. Venco. When it comes to antibiotics, Venco are the big guns. Why? Because the adverse reactions are so bad. We don't give Venco unless nothing else is working. We've tried everything else. And so this is our Hail Mary, right? Venco is not our first two, our second go-to, even our third go-to class of antibiotics we give when a patient has an infection because there are so many adverse reactions. You absolutely need to know those adverse reactions for vancomycin. Now, not only do you guys need to know that, you guys also need to know these other drugs. You need to know metformin. You need to know that it is an oral anti-hyperglycemic agent. You need to know that if a patient's taking this drug and they have to get some type of like a procedure done that's going to use contrast media, they have to be on off this medication for a couple days. We're concerned about lactic acid. That's huge. You got to know about vasopressin. You got to know it's a hormone. And the pyridine, you need to know that that is an opioid. So you do have to know these other drugs as well. Okay. Select all that applies. Atropine should be avoided in patients with which diagnosis? Select all that apply. Here are your options. Cardiac arrhythmias, acute hemorrhage, tachycardia, angle closure glaucoma, constipation, urinary retention. Atropine should be avoided in patients with which diagnoses? Select all that apply. Oh, you know what? Another test question on NCLEX. Let's go back to cefdinir. When it comes to cefdinir, a contraindication, if that patient has an allergy to penicillin or cephalosporin, you're not going to give that drug. There's so many other antibiotics on the market that that patient can be given. You're going to withhold that drug and call the healthcare provider. That's another question. But anyway, back to atropine. Wow. Okay, let's talk about it, guys. If atropine's been ordered for your patient, by the way, you need to know what atropine is. It's an anticholinergic agent. If that's been ordered for your patient, you are not going to give that drug. If the patient has acute hemorrhage, they've got tachycardia, they've got angle closure glaucoma, they've got constipation, they've got urinary retention. Okay, this medication will make it even worse. I've said it a million times. When you think of anticholinergic agents, I want you to think of this poem. Anticholinergic agents can't see, can't spit, can't pee, can't, all right? Can't see, vision issues. Can't spit, dry mouth, xerostomia. Can't pee, urinary retention. Can't, constipation. Can't see, can't spit, can't pee, can't. All right? Those are contraindicated. You are not going to give this type of drug to a patient that has any of those. Congratulations, Miss Carla. All right, which drug is known to treat Parkinson's disease? Would it be carbamazepine? Would it be carbidopa levodopa? Would it be Lantus? Or would it be indomethacin? Again, guys, these four drugs all have been seen on NCLEX 1,000,001 times. Make sure you know all of them. But for this particular question, we're talking about Parkinson's. What drug is known to treat Parkinson's disease? Very good. Carbidopa levodopa. Something else you got to know about Parkinson's that um, is thought that what causes it is the low dopamine level. Carbamazepine, what's that? An anti-seizure drug. Lantus, that's a long-acting insulin. And last, the indomethacin, it's an NSAID. Make sure you know those drugs as well. Which drug, if administered IM, must be given using the Z-track method? Would it be potassium? Would it be morphine? Would it be magnesium sulfate? Or would it be ferrous sulfate? Which drug, if given IM, needs to be given using the Z-track method? Very good. Ferrous sulfate. What is ferrous sulfate? Yes, very good, guys. Iron. Iron is very, very, very irritating, so we don't want it leaking out. It's very irritating and it stains the skin. So you're going to give it Z-track method. Important things to know about iron, if it's um given by injection, well, iron period doesn't matter how it's given, but iron period is very, very, very constipating, right? So you're going to make sure that patient's drinking lots of fluids, eating lots of fiber. You're making sure your patient ambulates. If iron is given PO by mouth, remember I said it's very staining, so you're going to be very careful, especially if it's a child and they still have teeth coming in, right? You're going to make sure that if the patient's drinking the iron, that is they're drinking it through a straw. Iron needs to be absorbed. And so how's it going to be absorbed? Iron's going to be given with what? Ascorbic acid, vitamin C. Vitamin C helps with the absorption of iron. You're going to stay away from things, dairy products, things that have milk that can decrease the absorption of iron. So make sure you guys know iron, but these other options you guys got to know for NCLEX. Potassium, you got to know the therapeutic range of potassium, 3.5 to 5. You guys have to know the nursing interventions for potassium. You're going to have that patient on a cardiac monitor. We're concerned about cardiac dysrhythmias. Morphine, you need to know the drug class. You need to know that's an opioid. You're going to be concerned about respirations being too low, heart rate possibly being too low. You're going to be concerned about constipation as well. Magnesium sulfate. Usually on NCLEX, when it comes to mag sulfate, they're going to present it as a maternity patient in L&D. You need to know the therapeutic range. You need to know signs and symptoms of toxicity. And I just told you what you need to know for iron. So make sure you guys go back and review these drugs before you go take boards. Make sure you know them well. That's right, deep tendon reflexes when it comes to mag sulf. Absolutely. Excuse me. Which drug has an adverse effect of QT prolongation, tardive dyskinesia, agranulocytosis, and seizures? You need to know this. Would it be your SSRIs, your beta blockers, your calcium channel blockers, or your antipsychotic agents? QT prolongation, tardive dyskinesia, agranulocytosis, and seizures. What are we talking about? Oh, I just saw of another test question. A couple slides ago when I was talking about the carbidopa levodopa, another one that they like to ask about in regards, guys, I don't do the lives with anyone. Stop asking, please. Um, what was I talking to you guys about? Oh, yes, carbidopa levodopa. Another test question they like to ask about. Oh, what other conditions, what would be contraindications Never in your life, okay, are you going to give that drug to a patient that's also taking an MAOI. And you're never going to give it if the patient has glaucoma or if they've got like cancer like melanoma. Those are huge contraindications. You are not going to give that drug. All right, back to this question. So this question says, which drug has an adverse effect of QT prolongation, tardive dyskinesia, agranulocytosis, and seizures? The correct answer is antipsychotics. The famous one NCLEX likes to ask about in regards to this type of question is going to be your haloperidol, your Haldol. All right. You need to know these other drugs because those are asked on NCLEX as well. You need to know the SSRIs. You need to know that those are your first line drugs that you expect to be ordered for a patient with depression. Why? Because it's the most effective with the least amount of adverse effects. Beta blockers, antihypertensive agent. Let me tell you what you need to know about beta blockers. NCLEX will ask you, they'll give you a situation with a patient that has some type of respiratory condition. Maybe patient's got, asthma, cystic fibrosis, bronchitis, whatever. And they also happen to have hypertension. And they're going to ask you, what drug do you expect the healthcare provider to order? Or what drug, if the healthcare provider ordered, would you question? So what does that mean? That means you need to know the difference between those drugs that are cardioselective and non-cardioselective for the beta blockers. Don't say I didn't warn you. You got to know that. Calcium channel blockers, you got to know what drugs fall into that class of drugs. Usually it's those drugs that end in pene, but you have your outliers like verapamil. So make sure you know your calcium channel blockers. You're going to make sure you dangle the patient before they get up. You're going to prevent orthostatic hypotension. Safety is a big issue when it comes to the antihypertensive agents, okay? How are you doing on the live? All right. I'm going to continue. All right. What type of insulin could cause the patient to be hypoglycemic an hour and a half to 2.5 hours after it's been administered? This is the scariest time for insulin. Would it be short-acting insulin? Would it be intermediate-acting insulin? Would it be long-acting insulin? Or would it be rapid-acting insulin? What type of insulin can cause the patient to be hypoglycemic in 1.5 to 2.5 hours after administration? All right, guys. Regular insulin, that is the one we're going to be concerned about. Now, no, not long. Think about it. Listen. Long-acting insulin, that is the insulin that gives you what's the word I'm looking for? A steady dose of insulin throughout the day. And I typed this in wrong, but guys, it's regular insulin, okay? But long-acting insulin, it gives you steady amount of insulin throughout the day. So what happens is, why is it called long? Because it lasts for 24 hours. There is no peak. So it couldn't be long-acting insulin, right? Now, something that you guys need to know, I know you guys think NCLEX is tricky, but it's not. You just have to understand the phrases and the wording used. So let me explain to you. If they say to you, your patient's diabetic, they're getting insulin, when would you expect to feed the patient? If the question's asking you about when to feed the patient, here's what they're really asking you in regards to the insulin: the onset. The onset of the insulin tells you when you need to feed that patient, right? Because does that make any sense? You're going to go ahead and give insulin to a patient and they don't have any food in their system? No, they're going to bottom out, right? So when you expect to feed that patient, that's the onset. If the question asks you, when do you expect to reassess the patient? When is the most dangerous time for the patient? When are you going to go recheck that patient, right? What are we going to be concerned about? What they're really asking you in regards to the insulin is the peak time of the insulin. Because the peak time of the insulin, when that insulin's working the best, guess what? that's when that patient's blood sugar is going to be the lowest. That is the most dangerous time. What kills you faster? Hyperglycemia or hypoglycemia? Hypoglycemia. So the time that your blood sugar is going to be the lowest, that is the most dangerous time. That is the peak time of the insulin. So whenever the question asks you what's the most dangerous time when you're going to reassess, what they're really asking you is the peak of the insulin. If the question asks you when you expect to give the next dosage of insulin, let me tell you what they're really being asked. What they're really asking you is the duration, right? Because if that insulin lasts for 2 hours, that's the duration of time you expect to give that next dosage in what? 2 hours. Okay? Don't let NCLEX fool you. Think about it. Feeding, onset, reassess, peak, next dose, duration. Boom. That's it, guys. You got it? All right, let's keep going. All right. Ketorolac administration should not exceed how many days? Is it 1? Is it 3? Is it 5? Or is it 7? You guys are close. Most of you on the live are between 5 and 7. The correct answer is 5. And the reason for that, guys, oh my gosh, those adverse effects are so bad. Like toxicity is so bad. Like, so we don't take any chances. No more than 5 days should this patient take this drug. This drug actually falls under 2 classes. It falls under NSAIDs, but also non-opioid analgesic. And those adverse effects, this drug can cause the patient to go into acute kidney failure. It can cause the patient to start bleeding. It can cause the patient to have peptic ulcers, bleeding ulcers, right? So it can cause the patient to have fluid retention, hypertension. I don't know if I mentioned hypertension, but that's a big one as well. So we're not to give this drug for more than 5 days. It's not to surpass 5 days because of those adverse effects, especially if the patient gets a toxic level in their system. I just had this question and still got it wrong. Oh, I'm so sorry. Well, now you know what the answer is and you know why. Listen, I'd rather get these questions wrong with me so you can get it right on your test. All right, last question. What is the therapeutic range for lithium? Anyone that's been following me, you know the answer because I've been drilling this down your throat. You absolutely need to know this for NCLEX. Here are your options: 0.2 to 4, 0.6 to 1.2, 1.3 to 5, or 5 to 7. What is it? Very good. Therapeutic range is 0.6 to 1.2. You need to know that. You need to know the drug class of lithium, which is a mood stabilizer. And CLEX expects you to know, they expect you to know after what level would the patient be considered to have a toxic level once it's higher than. So even though the therapeutic range is 0.6 to 1.2, once it's higher than 1.4, that's when they're in lithium toxicity. You're expected to know that. NCLEX expects you to know the electrolyte that you're going to be monitoring while this patient is on lithium. It's going to be sodium. Regular sodium is supposed to be 135 to 145. If the patient has too much sodium, the patient may have a subtherapeutic level of lithium. And if they have too much sodium, no, if they have too much sodium, they'll have a subtherapeutic level. I was right. But if they have too little sodium, it can cause the patient to have lithium toxicity. So you got to know both ends of the spectrum. Also, NCLEX expects you to know those signs and symptoms of lithium toxicity. You know, blurred vision, seeing halos or green or yellow around objects, confusion, weakness, lethargy. Make sure you know those signs and symptoms of lithium toxicity. Okay? And guys, there are so many more drugs that you need to know for NCLEX. So if you guys want me to do a part 2, 3, 4, 5, even 6 for drugs that you need to know for NCLEX, let me know in the comment section. I'd be more than happy to do that for you. All right, guys, let's see how you guys did.